Hello, everyone. Welcome back to another Dr. Ken's ASMR video. Welcome back. I hope you're having a wonderful day, and I hope you're having a wonderful night. Today, we'll be talking about a very basic and yet very interesting and important topic. And this is something that anyone in the medical profession would know about. And that is, of course, the patient interview. It is extremely important for any doctor or nurse or medical practitioner to know how to conduct interviews for the patient and to make sure that they provide you with the information that you need to help them. Yes, in a way, it is exactly like I help you help me, and you help me help you. It is very mutual, and it is required with a foundation of trust, a sense of rapport, a link, a bond between the patient and the doctor. So, without further ado, let us begin this video and talk about the patient interview. So, what do you do when a new patient comes into your office or into your workplace and wants to seek treatment or wants to become your patient? So, the first thing is, of course, to say hello. Be nice, be polite, smile, keep an open body language, and try to make sure that the patient is comfortable. Make sure the patient does not feel that they are watched, they are under pressure, or that they are in any way feeling inadequate. Of course, besides the fact that they may require some medical attention or future medical attention. So, after you have made your greetings and you have asked your patient how he or she would like to be addressed, and you address them in that manner, then what do? And that is, of course, to ask them about their chief complaint. Yes, the chief complaint. What is the chief complaint, and what is a chief complaint? The chief complaint is the main reason why they have come to see you. It is the main reason that has brought them to you, to your workplace, to your office, your hospital, your clinic. And the chief complaint is what makes them come to ask you about what is wrong with me, doctor, or what is wrong with me, nurse. So you want to make sure that you know what is the main reason, the main thing that is bothering them. Okay? So, after you have established that, you want to ask them more about this, and then we go into the history of present illness. So, not all of these questions may be necessary, but it is always a good idea to be thorough. It is most often more risky than not if you are not thorough. But of course, as you become more experienced, use your judgment, and sometimes you may need to ask more questions about a specific area. So, the first thing you want to ask is, where is the pain? Where is the pain in the body? And what part of the body, a specific area? Is it a large area? Is it a small area? And does this pain radiate anywhere? Does it spread? And the next thing you want to ask about is the timing. So when did it all start? I want to get to know more about this history, the history of this present illness. When did it start? And how long has it been going on? Is this the first time you've been having this problem? Or have you been having it for a long time and it recently got worse? Has it been staying constant, being consistent, or has there been any changes? And also, is the pain intermittent? Does it come and go? Does it happen in specific situations, specific environments? Are there certain triggers that cause it? You want to know all of these things. And third, you have to ask about the quality of the pain. So the pain can be exhibited in many different ways, and sometimes it can be a sharp pain, sometimes it can be a dull pain, sometimes it is achy rather than severely painful. Sometimes it can feel like a pressure, a tightness, or sometimes it can be tingly, but not tingly like ASMR. No, not at all. It can be a very uncomfortable tingling sensation, such as when you have been sitting on your hands or sitting or sleeping on your arm overnight, and then finally when blood goes back to that body part, then it feels like pins and needles, and that is not the kind of tingling that we're looking for. Well, not in ASMR videos, but that is the kind of tingling that we are looking for in a patient interview. And of course, we want to ask about the severity or the intensity of the pain. We usually ask the patients to rate the pain from a scale from 1 to 10, with 1 being the not painful at all, and 10 being the most pain they have ever experienced. And so please make them try to put it on a scale, try to rate the pain on top of the other things that we mentioned. And of course, we have to ask what triggers these symptoms. As we've mentioned earlier, the timing. This is also part of the timing. This triggers, unlike the triggers for ASMR, they are the things that make the symptoms more severe or make these symptoms occur. So you want to know, when did these things happen? What were you doing when it happened? Do you know what caused it to occur? And also, we want to ask about anything that makes it better. So what does the pain do under certain situations? Of course, sometimes it can be worse, but are there anything that you do that makes it better, that makes it more comfortable, something that makes the pain lessen? So you want to know these things. You want to understand the pain. You want to understand the symptoms, these discomforts, because these are all very important clues, important details that you don't want to miss when you are doing a patient interview. And of course, don't forget to also ask about any other symptoms that they may have, because while they may have a chief complaint, they have these things that is the main reason the main reasons, perhaps, that makes them come to you. They all may also have many other symptoms. Hopefully, not that many, but they may have other things that are bothering them but aren't telling you. And you don't want to miss them either, because those that do not bother them the most might actually be very important to know. Okay, and on the second part, we want to ask about their past medical history. So after we have asked them about the history of present illness, we want to know also about anything that may have happened to them or they have done in the past concerning their health. In terms of their past medical history, you really want to start as early as possible. If you want to be really thorough, you want to try to ask about more specific dates, the age of the patient, when it happened. But of course, use your judgment if this is something that, if what brought this patient to you was something more of an acute injury, then I really wouldn't ask too much about any early prior childhood illnesses, for example. But of course, let's start with childhood illnesses, and this may be very important, especially if this is more of a chronic disease or you think this may be a complication of an earlier disease. So you want to ask about childhood illnesses, and you want to ask about adulthood illnesses, so something that they may remember, because childhood illnesses, unless it is something that is very well known to the patient and their family, they may have forgotten it. They may not have paid so much attention to it. They may have thought that it was nothing, so they don't pay much attention to it. But for adult illnesses, most likely they will remember, especially if it is something serious. And of course, include any recent infections. For example, they may say they have gotten a cold, but it could have been a more serious infection. And also surgeries. We don't want to forget about that. Any kind of operation, prior surgeries, it could have altered their body, their health in a more significant way that they imagine. So you want to know about these. Any hospitalizations? Have they ever been hospitalized? Anything that were so serious that they had to stay in the hospital or visit the hospital due to something such as injuries or trauma, or you do want to ask about vaccinations. For children especially, because some parents, they don't like to vaccinate their children, and that may be a very risky thing for the child, regardless of the political agenda that anyone has. It is just a known fact that if you're not vaccinated, then this unvaccinated person is more prone to these infections. Okay, and also you want to ask about any allergies, because, and this is especially important, especially if you're going to be prescribing medication. If you're thinking about prescribing medication, you do not want to prescribe medication that this patient is allergic to. That is just a big no-no, and it could have been easily avoided if you had just gotten the pertinent information. So you want to make sure that your patient is not allergic to any kind of medication, and if they are, make sure you make a note of that so you do not make the mistake of prescribing that medication. Or allergies to pollen, if it's seasonal, or dietary. Seafood is a common one. nuts, maybe some berries, or maybe some kind of plants. So it is very important that you ask about these things to make sure that your patient is okay with it all. And even if they don't know, then at least you asked. You have to make sure that you don't forget. All right. And let's talk about the current medications. So, if you're thinking about prescribing medication, you also have to think about what is your patient taking right now. You have to get a whole list, a detailed list of all the things that your patient is taking, including supplements. Don't forget, supplements is also something that they put inside their bodies. And it's not just food, not just drugs, but supplements. A lot of people don't think of them as drugs, but they do have an effect. They do make a change in your body. So whether big or small, so you want to know these things. So let's ask about the current medications that they're taking. If they're not taking anything, then they're not taking anything. But if they are, then you want to ask about first, what is it? What is it? Is it the name of the medication? You want to know that. And if you don't know what that is, you want to look it up for sure. And you want to know what the dosage is. So how much are they taking? How often are they taking it? Make sure you have the correct units. It's very easy to sometimes make the mistake of thinking about the wrong unit, and that is just not what you want to do. Please don't make that mistake. Please don't make that mistake. I know I have, and it is not pretty, and it is so preventable. But we're only human, and yet that is something that I hope no one will ever do again. Just be sure that you know what you're talking about when the patient is giving you these details. Okay, and how is the patient taking it? If it is something that they can swallow, if there's something that they have to chew, is it sublingual? Are they injecting it at home? Different ways of administration. It is important to know these things as well. Okay, and of course you want to know why they're taking it. So if they're taking a beta blocker, for example, maybe they have a heart condition, and you want to know the reason why behind every drug that they're taking. And they may not know, but if you can consult their previous physician, that would be very helpful. Most often, the patient will know because they should have been well informed by their primary care physician about who prescribed these drugs, about why they're taking it. And you want to know how long they've been taking it. Sometimes drugs are used for emergency situations, for acute conditions, but most often drugs are prescribed to people with a chronic condition, and it is necessary. It has been a part of their lives for a long time, and you want to know about these things. And you can ask the patient if it is working. Do they think that it is helping them? Or if it doesn't, why do they think that is? And also, important thing is to ask about side effects. So they're taking drugs. Every drug has a side effect. We should never forget every drug has a side effect. So how are they being affected by it? And what kind of the comforts that these drugs provide and the discomforts that these drugs provide. And also, you just maybe want to ask a little bit about compliance. And compliance is about whether a patient is actually following the doctor's orders and taking the drugs as they have been instructed to. Some patients they may have forgotten to take it, and that's okay if it is truly unintentional. But of course, there are some people in this world who thinks that they always know the best and they don't need anybody's help after they feel, especially after they feel better. So they think, oh, I don't have to take these drugs. It's okay. And that's just something you might want to bring up, especially if this patient is being prescribed all the right medications and yet they're not improving at all, or for a fact that they don't come to your pharmacy to refill their prescriptions. So a lot of these things are important to ask. Please don't forget to try to be as thorough as possible, especially if you have time, and especially if this is a new patient. Oh, and some of these forgotten medications, I'll just mention them quickly. So, birth control pills for females of childbearing age. If they are taking birth control pills, a lot of them don't think that they are a type of medication. Perhaps, as I mentioned before, they have been a part of their lives for so long, or they don't think of them as drugs, such as antibiotics, but they are definitely considered medication. Creams and ointments, just because you don't swallow them, you don't inject them directly into your body, they are still medication, and that's why they work. When you get an insect bite, and you put on some creams, some ointments, to make the itch go away, yeah, that is also medication. Just because it's absorbed through the skin doesn't mean it's not medication. Oh, and eyes and ears medication. Again, some people don't think that don't think they're drugs because you don't swallow them or you don't inject them, but that is of course not true. Inhalers, now inhalers are a bit of an iffy area, because I think inhalers are usually not forgotten if people are inhaling it, most likely due to conditions such as asthma. Then they will know that they have this condition and they would think of it as a medication. So make sure that you remember these things. And again, like I mentioned earlier, supplements. So they might just be taking multivitamins. They might be just taking vitamin C, vitamin B group vitamins, and they think that, oh, it's just vitamins, it's not medication. But that is, again, not true. If it can make a change in your body after you administer it, then it is a drug. So don't forget about that. And also herbal and natural products, herbal supplements. If you are taking any kind of capsules, tablets that advertise themselves as these healthy herbal supplements that somehow make you healthier or better, and then they can be medications for sure. But you definitely want to know what are the ingredients, what is the composition of these supplements, so you can make sure that any drugs you prescribe will not interact with them in a negative way. Okay, that is why we have to ask about this, because of drug interactions. And of course, you want to know, even if you're not prescribing any drugs, you still want to know these things, because they may be actually affecting your patient in a way that you don't want them to. So, of course, if they are actually improving the health of your patient, the condition of your patient, then great. But if they're not, then you want to know for sure. Okay, guys. I'm sorry I just rambled on and on without really much of any of the usual tapping and scrubbing and water sounds, those kind of ASMR triggers, but I really hope you have enjoyed my medical themed ASMR video. Today, this is just, I think, part one. Perhaps there will be a part two, part three of the patient interview, because this is very important to get right and to become better and more efficient at. I'll try to get into more detail. I hope you have enjoyed it, and if you haven't, please like and subscribe to my channel, and I'll try to make another video in the future, part 2 or part 3, about patient interviews. And please look forward to future ASMR content, medically related themes, videos from me, Dr. Ken. Thank you very much. Have a good night and take care.